Jordyn. I'm going to be your student nurse today. I'm going to be performing a head-to-toe assessment on you. I'm just going to start by washing my hands, and then I'm going to provide privacy by closing the curtain. Can you verify your name and date of birth for me?
Amanda Lynch, 5/28/96.
Okay. And do you have any pain today?
No.
Do you have any allergies?
No.
Okay. Can you tell me what today's date is?
April 5th, 2016.
Okay. And can you tell me where we are?
Detroit Mercy.
Okay. The patient is A&O times 3. The patient's speech is clear and the volume is appropriate for the situation. The patient's mood and affect are appropriate for the situation. The patient's calm and not agitated. The patient appears their stated age and appears to be in good hygiene, has no foul body odors or anything, and the patient also does not have any present signs of any illness. Okay, so now I'm going to go ahead and I'm going to get started with the assessment. So I'm going to first start with your skull. So I'm just going to palpate your head. The patient's skull is symmetrical and there's no lumps. There's no signs of any lesions or any cuts or anything. The patient's hair is clean. There's no parasites, lesions, redness, or any lumps. Okay. Next, I am going to feel the temperature of your skin with the back of my hand. Okay. The patient's temperature of their skin is warm. The skin is dry and it's appropriate for race, and the skin is intact. There's no cuts or lesions. Next, I am going to have you raise your eyebrows, please, and puff out your cheeks, and smile for me. Okay, and then I'm going to have you close your eyes, and I just want you to tell me where I touch.
Forehead, cheek, chin.
Okay, the patient's cranial nerves 5 and 7 are intact. Next, I am going to look at your eyes. I'm just going to shine this light in your eyes. If you could just look straight forward. Okay, and then if you could just follow my pen. Okay, the patient's pupils are round, they're equal, and they're reactive, and they also accommodate. And then I'm going to look, just pull down here. Okay, the patient's conjunctiva is pink and the sclera is white. Next, I'm going to look at the rest of your face. The patient's nose is midline and the lips are symmetrical. I'm going to have you open your mouth, please. Okay, can you say ah? Okay. The inside of the patient's mouth is pink and the membranes are moist and free of any lesions or bleeding. The patient's gums are pink, moist, and free of any lesions, swelling, or bleeding. The patient's tongue is symmetrical and it is pink, moist, and does not have any abnormal coatings or lesions. The patient's tonsils are a grade 1, and the patient's uvula is midline, and it is mobile because it retracts when she says ah. Okay, and the patient's lips are pink, they're not cracked, they're moist, and they do not have any lesions, cuts, or bleeding as well. Okay, and can you turn to the side for me? Okay, and to the other side. Okay, the patient does not have any signs of JVD on her neck. Next, I am going to listen to your heart. I'm first going to listen at the aortic valve, which is the second intercostal space on the right side. Then I'm going to listen to the pulmonic valve, which is on the left side, the second intercostal space. Then Erb's point, which is third intercostal space. Then the tricuspid valve, which is the fourth intercostal space. And then the mitral valve, which is the fifth intercostal space. At the mitral and tricuspid, S1 is louder, and at the aortic and pulmonic, S2 is louder. So I'm just going to go ahead and listen to your heart. Here at the mitral valve, I will listen for 30 seconds to get the apical rate, and then after I listen for 60 seconds, I'm going to go back and listen up the opposite way with the bell of my stethoscope. heart sounds were clear. There was S1 and S2 were heard. There was no signs of S3 or S4, so there was no murmurs. Next, I'm going to go ahead and listen to your lungs. I'm going to listen in 8 spots on the front, 2 on the side, and 10 on the back. So when I put my stethoscope on your chest, if you could just take some deep breaths in for me. Okay, if you could just raise your arms. I'm just going to listen on the side. Okay, now I'm going to go ahead and I'm going to listen on the back. Take some deep breaths, thank you. Okay, the lung sounds were clear. They were free of any adventitious sounds, and they were clear bilaterally on both sides. I'm going to have you lean forward, please. Okay. I'm going to assess your spine. The patient's spine is straight. There's no signs of any curvature or any protruding vertebrae. Next, I'm going to just tap here. Let me know if you feel any tenderness or pain.
Nope.
Okay. And then I'm going to look at the anterior-posterior diameter. So the diameter is a 2-to-1 ratio. Next, I'm just going to assess your carotid pulse. So I'm just going to okay, the carotid pulse is +2 and it is equal bilaterally. And next I'm going to assess for bruits with the bell of my stethoscope. So when I put my stethoscope to your neck, if you could just hold your breath, please. Okay, and there were no signs of any bruits. Next, I'm going to assess your abdomen. So if you could lay on your stomach for me. Okay, I'm going to start by auscultating the abdomen, and I'm going to start in the right lower quadrant. Okay, bowel sounds were heard in all 4 quadrants. Next, I'm going to percuss the abdomen. Let me know if there's any pain. Okay, and in the right upper quadrant, the sounds were dull over the liver, and in all the other quadrants, the sounds were tympanic. Next, I am going to palpate the abdomen. Let me know if you feel any pain. Okay, no, okay. And in each of the quadrants of the abdomen, in the lower right quadrant is the cecum and the appendix. In the upper right quadrant is the gallbladder and the liver. In the upper left is the spleen and the stomach. And in the lower left is the descending colon and the sigmoid colon. Okay, next I'm going to assess your arms. So if you could sit up for me, thank you. Okay, I'm just going to start by feeling the temperature of your skin. Okay, the temperature of the patient's skin is warm. The hair is evenly distributed on the arms. There's no signs of any lesions, and the skin color is appropriate for race. Next, I'm going to feel your brachial pulse. Okay, the brachial pulse is +2, and it is equal bilaterally. Next, I'm going to feel your radial pulse. Okay, the patient's radial pulse is +2 and it's equal bilaterally. Good, I see your fingers, and I'm going to test capillary refill. Okay, the patient's capillary refill is less than 3 seconds, and the skin around the nails is pink and free of any cuts or lesions. Could you put your hands together like this for me? And there's no signs of any clubbing in the patient's nails. Could you squeeze my fingers for me? Okay, and the patient's muscle strength is equal on both sides. Next, I'm going to assess your legs. So I'm just going to feel the with the back of my hand, the temperature of your skin. Okay, the patient's temperature of their skin is warm. The hair is evenly distributed. The color of their legs are appropriate for race, and there's no signs of any cuts or bruises. I'm going to first start with your popliteal pulse. Okay, the popliteal pulse is +2 and it is equal bilaterally. Then I'm going to feel for your tibial pulse. Okay, the tibial pulse is +2 and is equal bilaterally. And then I'm going to feel your dorsalis pedis pulse. Okay, and that is +2 and is also equal bilaterally. I'm just going to test your Babinski reflex. Okay, and the Babinski reflex is working. And next I'm going to have you stand up, please, and close your eyes, and I'm going to test your balance with the Romberg test. I'm going to have you stand like this for 20 seconds. Okay, and your balance is good. Can you please sit back down for me? And then next we're going to perform the get up and go test. So you're just going to stand up, walk over there, turn around, and sit back down, please. Okay, and the patient's gait is steady, and they performs a get up and go test in an appropriate amount of time. And that concludes my assessment.